And now, let's hear from some of our patients about their experiences in our neuropathy treatment program.
After going to 2 other different places for treatment for my neuropathy, I came here. I decided this would be the place to come for treatment, which I've done. After 31 visits, I'm about 90 to 95% cured, and I am very fortunate that I came here.
I came in with a severe neuropathy. I've been somewhat skeptical about coming here. I've been in the healthcare business for 45 years, but after increasing doses of gabapentin and having made no real progress, I came here. After 2 treatments, I was able to sleep at night. Very shortly after that, I was back to my neurologist, and he was so impressed that I reduced my gabapentin by half, and now I'm down to a quarter of what it was when I first started. Have seen continuing improvement in both my feet in terms of endurance, walking and standing.
And let me begin by saying that over 5 years ago, at the age of 80, I was told by a well-respected neurologist that I had peripheral neuropathy, and that at my age I probably had it for quite some time, and that there was nothing they could do for me other than to take B12 and be very careful that I do not fall over. Well, to my surprise, the doctor thought that he could really have the potential of giving me some help. And here I am now in my 8th week of therapy, and the results have been amazing. I've no longer have the tingling and pain sensations in my feet. My balance has become just drastically improved, and on top of all of this, the greatest thing is that I'm sleeping better at nights. I wake up in the morning fully refreshed, and psychologically and mentally I'm just feeling a great deal significantly better.
I was having pretty bad neuropathy in both of my feet, and it was continuing to get worse after seeing the medical doctors. They really couldn't do anything for me but give me some pain pills and some vitamin B12 shots, and it continued to get worse, and so I decided I need to do something about it, be proactive, and I saw the ad in the newspaper, so I came to get tested. Sure enough, I was in pretty bad shape. I have considerable improvement. I'm down to maybe 1 incident a week right now. I've been coming for 3 weeks. I was having 5 or 6 incidents a day at the start, so it's helped a lot. The diet has helped a lot with the anti-inflammatory diet, the deflating diet. I probably lost about 7 or 8 pounds already, and feel better, and have completely changed what I'm eating, because I was eating all the wrong stuff, and I've already cut back on some of my diabetic medications with seeing my doctor. It was okay. We did some blood work and stuff, and also on my GERD stuff, cut my Nexum in half already.
My feet have been dead for quite some time, and I got concerned because 2 different times in my pickup I had my foot on the accelerator instead of the brake, and I almost ran through the carport. So we started the treatments. About 3 to 4 weeks into the program, I noticed that after I'd done my home treatment, I could feel the carpet when I was walking. And that's the first time I've done that for quite some time. So continue to see improvements. I think I had only about 15% feeling in my feet when we started, and halfway through the program they checked me and I was up to 60%. So it's been very helpful. It's made me feel better, more confident in my driving, more confident in my walking.
What is your motivation? Why do you want to get healthy and reverse your neuropathy? Your motivation in this process is going to be our motivation, so we'd like to ask you to think about that for a moment. It could be that you want to be able to play with your grandkids, maybe go on a walk again with your loved ones, or maybe you just want to have the ability to take care of yourself without relying on anyone else. With our health, we really only have 2 directions we can go. You could be moving toward greater health, or you could be moving away from it. No matter where you're at right now, it's never too late to improve your health or your well-being. So who should come to see us? Well, it's really very simple. If you have the symptoms of neuropathy, come see us. It would be silly not to go through our process to see if we could help you. If you have any of these symptoms, numbness, burning pain, cramping, sharp electric-like pains, prickling or tingling, if it hurts when you walk or you have balance problems, if you can't sleep at night because your feet hurt, you should come see us. Let's find out if we can help you. We are looking for 2 types of patients that we accept into our program. Type 1 is people who are all in with their health. They value health. They want to live longer to be with their family. They want to be productive. They want to perform their best in life. And they just generally want to thrive in life and with their health. Type 2 are exactly the same as patient type 1, except they might fall off the wagon here and there. And that's okay, because our team is here to help you and support you and get you back on track. Who should not come to see us? Well, that'd be patient type number 3. If you are looking for a quick fix, or if you don't want to take the time or aren't willing to invest into your health, then you would not be a good match for us. We are looking for patients who want to be an active participant in the process. We are extremely confident and competent in what we do. We don't take recommendations from outside sources. Our programs work as long as you commit yourself to them. And if you make that commitment to yourself, you are going to get great results. So what should you expect when you come to see us? Well, first you'll get an application for admission to our program. You'll receive a consultation. Your practitioner will go over your health history and give you an exam, and then they'll present you with a report of their findings. When we evaluate our patients, we have a 16-step evaluation process that helps determine what kind of nerve fibers you have that are damaged, exactly what kind of treatment you'll need, and how long it'll continue. We want your spouse or significant other to be a part of this process. Neuropathy is a serious condition. We want them to understand your condition and what it's going to take to get you better, so we can all sit down and make a decision together to see if you're a good candidate for our program. We have a specific process that works, and it includes your significant other being a part of the decision process. If you weren't coming to us through a webinar, a seminar, or a free pre-education consultation, the cost for your initial evaluation and consultation would be $249. Since you came today, and we only have the evaluation process to do, it's only $87. At this time, insurance questions sometimes come up, so we like to be very upfront and transparent with our potential patients. Let's go back first, though, and talk about the 2 different types of conditions that we spoke about at the beginning of this presentation. We have acute care, where there are drugs, surgeries, and injections used, and that's commonly what insurance covers. The problem is that neuropathy doesn't need an acute care approach because it's not an acute care condition. It's a chronic condition, and as such, it requires a systematic approach to get outside of the drugs, surgery, and injections paradigm so you can get better. Please do not wait and let your neuropathy get worse. Neuropathy is a progressive condition, meaning it gets worse over time. We are here for you. You're in great hands. The practitioners who are using this program really know what they're doing, and they're going to help you get the results you want so you can get back to living your life. This next video really makes it clear that there are 2 paths for your health. Either you're moving toward greater health, or you're moving away from it. I'd like you to think about that as you watch it. Where would you like to be?
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.